Craziest things doctors have said. So, a little context first. This all happened before I was diagnosed with Crohn's. At the time, I didn't know what was going on, but I noticed something alarming. Something was definitely not normal with my digestive system. And by alarming, I mean there was blood. Blood in my poop. A lot more than I ever expected. Naturally, I freaked out a little, a lot, and made an appointment with my doctor. I wasn't really sure what I expected, maybe a casual check, a prescription, some reassurance. I didn't expect the absolute nightmare that followed. The day of the appointment, I tried to calm myself. I thought, it'll be quick. Doctors do this every day. I'll just lie down, he'll check, and boom, done. How wrong I was. He called me in, asked the usual questions, and then said, let's take a look. I followed instructions, laying on my side, knees pulled up. I braced myself for the standard exam. Then, it happened. He put on a latex glove. Cold, clinical, unremarkable, at first. Then the finger went in. And holy, it was one of those moments where time slows down. You try to think, this is fine, this is normal, it's medicine, but your brain is screaming, this is not fine. After what felt like an eternity, probably 30 seconds, but who's counting, he pulled his finger out. I figured that was it. Wrong again. He looked at his glove, nodded, and said, yep, there's blood. Then he held it up for me to see. I wish I could say I was exaggerating, but the finger came way too close to my face. I flinched, naturally, and that's when it happened, the most intimate, awkward medical moment of my life. Let's just say my personal space was obliterated, and I had an entirely new appreciation for reflexes. I tried to laugh it off, maybe act like it was no big deal, but internally I was screaming. I wanted to disappear into the floor. I wanted to invent a time machine and go back to before this appointment existed. Most importantly, I wanted a new doctor. After the exam, I left as fast as humanly possible. I felt like I had survived a weird, uncomfortable horror story that no one warned me about. That night, I called my insurance, looked up PCPs online, and scheduled a new appointment. I even considered making a cardboard sign, please, anyone but him. Eventually, I got diagnosed with Crohn's, which explained the blood and a lot of the other strange symptoms. But even knowing that, I will never forget that first doctor visit. Story 2. So, when I was 18, I had one of those moments that really makes you question life choices, athletic skill, and fate itself. I was playing softball with friends, not even a serious game, just casual backyard fun. Somehow, in a move I can only describe as tragically heroic, I caught the ball straight in the eye socket. Yup, right in the eye. The pain was instant and intense, but the real horror came when I realized my eyebrow was now a human crater, and there was blood. A lot of blood. My friends panicked, calling parents, searching for ice packs, and offering half-hearted first aid. I just sat there, trying to convince myself this was fine, while secretly questioning why I had thought catching the ball barehanded was a good idea. Fast forward a bit, I end up at the doctor's office, sitting in a sterile, fluorescent-lit room, heart racing, trying not to pass out from a combination of pain, fear, and embarrassment. The doctor walks in. He's middle-aged, calm, almost too calm, like he's seen the human body in worse situations and thinks casual detachment is the cure for trauma. He looks at my face, then at the chart, then back at my face. I nervously ask, will this leave a scar? And then he delivers it. The comment. The line that I will never forget. Well, I could use a finer thread to make it less noticeable, but let's be honest, you're not exactly going to be on a billboard anytime soon. I froze. Did he really just roast me mid-medical procedure? My brain short-circuited. My thoughts were a mess. Are you serious? Did he just insult me? Is this a medical procedure or a comedy show? He didn't miss a beat. He got the stitches started, humming like it was just another Tuesday. Every pull of the needle, every stitch under my eyebrow, was accompanied by casual commentary on how most people won't even notice a minor scar. Meanwhile, I was internally screaming, questioning every decision that had led to this moment, playing softball, catching balls with my face, trusting humans to fix humans. Then came the worst part. I had to lie there, partially immobilized, with my eyes swollen shut, while this man casually analyzed my chances at modeling or fame. The absurdity of it all hit me. Here I was, potentially permanently marking my face, and the professional tasked with fixing me was rating my billboard potential. When it was finally over, he handed me a mirror. Sure enough, 6 stitches under my eyebrow, and the thread so fine it almost blended into my skin. But my ego? That's a different story. Story 3. I once went to my regular doctor for what was supposed to be a routine visit. Nothing dramatic, but somewhere between the blood pressure cuff and the usual "how have you been?" everything I'd been holding in just came out. I started crying and admitted that I'd been dealing with suicidal thoughts for a while. The room got quiet. He leaned back in his chair, clearly thinking hard, and asked very plainly, "What's been stopping you?" I told him the truth, that the idea felt humiliating, that I worried about the mess I'd leave behind, that I'd feel awful about hurting people. It wasn't a dramatic answer, just a tired one. He nodded slowly, then said something that made my brain completely stall. Well, technically, you wouldn't feel embarrassed or guilty. You wouldn't feel anything at all. You'd be dead. There was a pause. A long one. Then his face changed instantly. He looked horrified at himself. Oh no. No. That came out wrong, he said quickly. That was a terrible thing to say. I should not have said that. This is exactly why I'm not a mental health specialist. Please ignore that. I didn't know whether to laugh, cry, or crawl through the floor. On one hand, I understood what he meant in a cold, philosophical sense. On the other hand, it was absolutely not what you want to hear when you've just admitted you're barely holding it together. To his credit, he recovered fast. He apologized again, shifted gears, and actually helped me get a referral to someone who did know how to handle that conversation properly. Story 4. During my annual checkup, I was halfway through the breast exam when the doctor said something I wasn't expecting. You have very textured breasts. I blinked. Excuse me? I asked, leaning in a little. She smiled, completely unfazed, and said, yeah, have you never noticed they feel a bit like cooked spaghetti? I didn't know whether to laugh or recoil. My face probably said both. Before I could respond, she moved on to the other breast and out of nowhere tapped my nose with her finger, making a little boop sound. I froze for a second. I mean, I get humor, but this was a doctor's office. There's a line, right? Apparently, in her world, the line was more of a suggestion. After the appointment, I couldn't stop thinking about it. When I told my close friends later, they all started calling me spaghetti tits, and somehow it stuck. Every now and then, I still hear it in the background when someone laughs at a story I tell. Story 5. 4 months, our nights were absolute chaos. Our daughter had severe sleep apnea, and we had a home oxygen monitor that would go off constantly, sometimes every few minutes. Imagine living on 2 hours of broken sleep while this little machine blares alarms all night. My partner and I were exhausted, walking zombies during the day, and terrified for her. We finally decided it was time to take her to the doctor. We thought we'd get some answers, maybe a referral to a specialist, something that would help our family survive the nights. The doctor listened politely while we described her symptoms, snoring so loud it shook the room, pauses in breathing, the monitor going off dozens of times a night, and her general fatigue during the day. We explained how worried we were, not just for her health, but for her quality of life. He leaned back, arms crossed, and gave us a look that instantly made me regret coming in. Then he said, honestly, kids usually manage fine with sleep apnea. And let's be real, it's not like anyone's actually dying from this. I froze. My mind scrambled. Did he just say that? We had pictures, monitor readings, a log of every night's alarms, and yet he treated it like a minor inconvenience. We tried to explain again that this wasn't just about death, it was about constant oxygen drops, developmental risks, daytime sleepiness, and our own complete exhaustion. But he waved it off, telling us it was probably just mild and that surgery isn't always necessary. We left the office frustrated, angry, and still terrified. That night, as the monitor screamed again and we frantically checked her oxygen, I realized we couldn't rely on that doctor to take this seriously. We booked a second opinion with a pediatric ENT, someone who actually looked at her medical history, her symptoms, and the data from our home monitor. The new doctor agreed immediately. Surgery was necessary. The tonsils and adenoids were enlarged, obstructing her airway. After the surgery, the difference was astonishing. Our daughter slept through the night for the first time in months. The alarm stopped, and my partner and I finally started feeling human again. It was like a fog lifting. Story 6. I had a really unusual episode. My heart was racing, I felt dizzy, and my chest kept tightening for no apparent reason. I thought it was stress at first, but it kept happening more and more frequently, so I decided to see my primary care doctor. I walked in, explained what was happening, and mentioned that I had been feeling fatigued for weeks and sometimes short of breath. I expected some tests, maybe an ECG, or at least a referral to a cardiologist. The doctor looked at me and said, probably anxiety. Nothing to worry about. He didn't even schedule any tests. I left the office feeling a little uneasy but tried to ignore it. 2 days later, I collapsed at home. My roommate called an ambulance. At the hospital, it turned out I had a serious arrhythmia that could have been life-threatening if it had gone untreated even one more day. They stabilized me, and I spent the next few days hooked up to monitors, terrified and realizing how close I'd come to a major catastrophe. A couple of weeks later, I went back to that doctor, not because I trusted him, but because I wanted to update my medical records. He flipped through my chart, glanced at the hospital discharge summary, and said, "Oh, I see you had an arrhythmia. Wow, that was a surprise." I stared at him. "A surprise? You told me it was nothing just 2 weeks ago." He laughed awkwardly and said, "Well, sometimes these things are tricky. Glad you're okay." I didn't go back after that. I switched to a new primary care physician who actually listens, orders tests, and doesn't treat near-death experiences like a casual plot twist. Story 7. When I was 15, I went to my doctor for persistent skin issues. I had painful, inflamed acne all over my face, and it wasn't responding to over-the-counter creams. I was hoping for some guidance, or at least a prescription that could help. After examining me, the doctor asked casually, "So, what are you doing about this at home?" I explained my routine: gentle cleansers, avoiding certain foods, keeping it clean. Then I asked about options like stronger medication or hormonal treatments. He looked at me in a way I'll never forget. "You're way too young for something like that. You'll just become more reckless. You don't want to start messing with hormones at your age." I remember feeling shocked, embarrassed, and helpless all at once. Instead of helping me, he lectured me about responsibility and my choices, like my acne was a moral failing rather than a medical issue. I left without treatment and just tried to live with it. Years passed. My skin didn't improve. By my early 20s, the acne had left deep scars, and I was constantly self-conscious. Finally, at age 25, I went to a new dermatologist who ran tests and diagnosed me with polycystic ovarian syndrome, PCOS. The solution? The very thing my first doctor refused to prescribe: birth control to regulate hormones. One prescription later, my skin began to clear, and I finally started to feel like myself. Story 8. For a couple of years, I had been going to a clinic for regular screenings due to a family history of a rare blood disorder. The usual specialist was methodical, thorough, and always made me feel like my concerns were taken seriously. Every test, every follow-up, was routine and professional. One day, my regular consultant was out sick, so I ended up seeing a locum doctor I'd never met. I explained my history, my recent symptoms, and asked if there was anything unusual in my latest blood work. He listened, nodded, and then said something I'll never forget. "Well, honestly, I can't really tell you what will happen. Everything is in fate's hands. Sometimes we just have to trust the universe." I blinked. "Excuse me?" I tried to clarify, asking for a medical opinion, some concrete guidance. He repeated the same line, as if it were comforting: "Whether it's serious or not, it's beyond what I can predict. You just have to let it be." I left feeling more anxious than when I arrived. My usual consultant had always given me clear guidance, explanations, and next steps. This felt surreal. Story 9. So, a little confession. I'm a nurse practitioner in family medicine, and I recently had a visit that still makes me cringe. I was seeing a new patient, a woman in her early 30s. Toward the end of the appointment, I mentioned that it had been a while since her last routine wellness visit and asked if she'd like to schedule a comprehensive checkup sometime soon. She paused, gave me a side eye, and asked, "Wait, is that the one where you check everything?" I, thinking she meant a full physical, said lightly, "Yes, it's a complete exam." Her eyes widened, and she whispered, "Do we have to undress?" I chuckled nervously and said, "Well, yes, it's a standard physical. You'll change into the gown, I'll be in my scrubs, but we're not both undressing." She blinked for a few seconds, then laughed awkwardly. "Oh, I thought you meant, both of us." We both ended up laughing, but I spent the rest of the visit silently thanking my past self for always emphasizing professional boundaries in training. Story 10. I've been seeing my primary care doctor for over a decade, so we've developed a fairly friendly rapport. One afternoon, I went in for a routine checkup, and I asked her how she was doing, just small talk, nothing deep. Suddenly, she froze, took a deep breath, and started talking about how overwhelmed she'd been lately with her parents moving into assisted living. She described the chaos, the guilt she felt, and how stressful it was balancing work with her personal life. For a solid 5 minutes, she went on venting about phone calls, paperwork, and family drama. I just listened politely, nodding along, occasionally offering sympathetic comments. She eventually realized she'd been talking for a long time, and her face went red. "Oh my goodness. I'm sorry. I can't believe I unloaded all of that on you. That's so unprofessional." I laughed it off and told her it was fine, I understood. She'd been under a lot of stress, and I had known her for years. It didn't change how I felt about her. Story 11. When I was 12, I went to see a new chiropractor for a minor back issue. My parents were hoping it would help with my posture, nothing serious. From the start, things felt off. After the usual spine adjustments, he started asking extremely personal questions. He wanted to know about my diet in weirdly specific detail, and then he asked about my bathroom habits, how often I went, the consistency, even the color. I froze. My mom was sitting right there, and she gave him a look that clearly said not appropriate. I tried to answer politely, thinking maybe he was just being thorough, but the questions kept getting more invasive. At one point, he asked something totally unrelated to chiropractic care, something personal that made both me and my mom uncomfortable. That was it. My mom immediately stood up, thanked him, sort of, and we left. We never went back. Story 12. A few years ago, I had a minor sports injury, a sprained wrist from basketball. I went to the clinic and got a splint put on, with instructions to follow up if it didn't improve. A couple of days later, I realized I'd done the wrong exercises at home and made the swelling worse. Frustrated and worried, I went back to the same clinic, expecting just a quick check and maybe an adjustment. The doctor looked at me, shook his head, and muttered, "Honestly, sometimes I wonder how you survive your own decisions." It stung, but he wasn't being cruel, he was exasperated. I sheepishly explained what happened, and he sighed, redid the splint properly, and even gave me a detailed step-by-step guide to avoid making the same mistake again. Story 13. When I was 17, I started experiencing severe stomach pain, constant nausea, and fatigue. It was bad enough that I had to miss school regularly, and I noticed a strange swelling in my lower abdomen that I couldn't explain. I went to multiple clinics over the course of a year. Each time, the doctors asked me if I was stressed, not eating properly, or even trying to get attention. At one point, one doctor suggested I might be exaggerating because I was a teenager, and another asked my dad if I had been experimenting with medications or recreational drugs. I hadn't ever. I was extremely careful and had never touched that stuff. They ran some basic blood work and didn't find anything, so I was sent home each time with advice like drink more water or try to get more sleep. I left each appointment frustrated, feeling unheard and more anxious about what might actually be wrong with me. Finally, I saw a new gastroenterologist who listened carefully, ordered imaging, and ran proper tests. That doctor discovered I had a sizable benign tumor pressing on my intestines, which explained all my symptoms. Surgery resolved it, and I finally started feeling normal again. Story 14. I started having intense shoulder pain that made everyday tasks impossible. I went to an orthopedic specialist hoping to get relief. At my first appointment, he examined me quickly, shrugged, and said, "There's nothing wrong with you. Pain like this at your age is unusual. Maybe you're just overreacting." I explained that my pain was severe, that I had trouble lifting my arm, and that I wanted options that didn't involve addictive medications. He looked irritated and accused me of wanting drugs before abruptly ending the appointment. I left frustrated, in pain, and feeling completely dismissed. Over the next several months, I went to physical therapy and tried multiple home remedies, but the pain only worsened. Finally, I sought a second opinion with a different orthopedic surgeon. This doctor ordered imaging and found a torn rotator cuff that was causing all the pain. Surgery was scheduled, the repair went smoothly, and after recovery, I felt like myself again. Story 15. This isn't about me personally, but about my aunt. A few years before she had kids, she went in for a routine checkup, but there were complications. She was carrying a pregnancy that, sadly, was not viable. The doctor delivering the news chose, let's just say, the worst words possible. He said, almost flippantly, "Well, looks like the party's over in there." My aunt was stunned and shocked at how casual and insensitive the comment was in the middle of such devastating news. Things got worse. A few weeks later, she started having extreme abdominal pain. Another doctor ran imaging and realized that there had been an ectopic pregnancy in addition to the initial miscarriage, something the first doctor completely missed. The fallopian tube had ruptured, and she was rushed into emergency surgery. She survived, but it was terrifying, and the emotional toll was enormous. Story 16. A few years ago, I was seeing a therapist because I was struggling with extreme anxiety and depression. I had recently started a new antidepressant, but it wasn't helping at all. During one session, I broke down crying over the simplest things: emails I hadn't sent, chores I'd forgotten, even minor arguments with friends. Instead of listening or helping me work through my feelings, the therapist suddenly accused me of not being honest about my supposed alcohol use. He claimed that my inability to handle emotions was a sign that I was hiding a drinking problem, and if I didn't admit it, he threatened to call a social worker or involve other authorities. I was floored. I've never had any issue with alcohol. I was genuinely seeking help for anxiety and depression, not covering up anything else. The session ended with me feeling more terrified than comforted, and I immediately sought a second opinion. Story 17. When I was 14, I was preparing for a week-long wilderness trek through the Rocky Mountains with my scout troop. I went in for a pre-trip physical and to get a few vaccines. My doctor, who had grown up near the Rockies and had a lot of hiking experience, seemed skeptical. While I was sitting in the exam room, he leaned toward my mom and said, "Honestly, I don't think this kid will make it through a full week. The altitude and terrain will be too much." I could hear everything from behind the curtain, and it stung a little, but I just nodded and didn't argue. Fast forward a month, I returned to the clinic limping slightly with a sore ankle from the final day of the trek. My mom grinned ear to ear and said, "Guess someone was wrong." The doctor looked surprised, checked my ankle, and quietly admitted that I had actually completed the trek with the group and had even been one of the strongest hikers. Story 18. A while back, I had just finished an inpatient stay for severe depression. I wasn't there for anything dramatic at the follow-up appointment, just a routine issue that needed attention from my primary care provider. When the doctor finally walked in, he skimmed my chart, raised an eyebrow, and said with a half smile, "So, we doing better now, or are we still in crisis mode?" The tone caught me off guard. It wasn't concern, it was casual, almost joking. I froze, unsure how to respond. I tried to redirect the conversation back to why I was actually there, but he kept circling back to my recent hospitalization, asking questions that felt more like commentary than care. At one point, he waved his hand dismissively and said something along the lines of, "Well, let's hope we don't end up back there again, right?" No reassurance, no professionalism, just discomfort. I left the office feeling smaller than when I walked in. I didn't argue, complain, or explain myself. I just went home and started looking for a new doctor that same afternoon. Story 19. I was working at a family practice office. One day, the physician I assisted had just received some test results for a patient. Without warning, she handed me the phone mid-conversation and said, "Here, you take it. Just explain what the next steps are." I picked up and heard a middle-aged woman sobbing on the other end. She had just been told there was a serious blood-borne infection risk after caring for a dying family member and was terrified about what it could mean for her own health. She was hysterical, asking questions I wasn't fully authorized to answer, and clearly felt abandoned. Meanwhile, the physician had walked away from her desk, leaving me on the line with the patient. I tried to reassure her, explain the follow-up process, and schedule the correct specialist referral, but it was chaotic. The whole situation was completely mishandled, and I felt a mix of anger and helplessness watching my boss pass responsibility onto me without warning. Story 20. When I was 15, I went in for a routine physical. As usual, the doctor asked my parents to step out so we could talk privately. I honestly had nothing to report, no issues, no questions, no high school drama. Apparently, that didn't sit well. Instead of wrapping up, she spent 20 minutes lecturing me about my rough appearance and how it could make people assume I was using drugs. She claimed it was her duty to warn me that if law enforcement ever got involved, I couldn't blame her. Then she launched into a bizarre series of preventive tips, like hiding things in a friend's locker or backpack as a test, supposedly to catch trouble before it starts. I was baffled. All I'd done was answer her questions honestly and admit that my life was normal. I left the office feeling judged, confused, and slightly terrified for no reason. Thanks for watching. Don't forget to like and subscribe. Got a story to share? Drop it in the comments and let us know which one was your favorite.